Good morning, good morning. Welcome to Private Talks to Anthony Tay. We're going to have a insightful conversation. For those that are new to the channel, we make mental health conversation content that's going to be beneficial to your personal development and just to well-being. However, in today's conversation, we're going to be talking about breaking free from personality disorders, steps to recovery and growth. I really want us to be taking consideration, for individuals to be able to have a better understanding of personality disorders, right? We have borderline personality disorder, we have antisocial personality disorder, and just breaking down common misconceptions and overall just tangible steps we're able to kind of move forward to be able to have that recovery in addition to that growth and emotional growth overall, right? So stick with me, grow with me. We're going to be able to learn something throughout this video, right? So in our introduction, I want to be able to include that you are not defined by your disorder, right? So personality disorders are, not labels, they are challenges, right? So we got to be able to talk about the people that have been diagnosed with personality disorder, like borderline personality disorder, that BPD, or anti-personality disorder, ASPD. You may be misunderstood, trapped, or maybe feeling as if that you're in these, patterns, or just distant from the world around you. So, you're not stuck. Other people out there are going through the same thing as well, and, have been diagnosed as well. So you're not the only individual, and there is a way to navigate through this, like I said, with that self-compassion, positive mentality, and just understanding that there is supports out there as well. So in addition to our first segment, we're going to be talking about what is personality disorder, just for those out there, so we're able to learn, the definition of personality disorder are mental health conditions that affect how a person thinks, feels, and behaves in a way that is inconsistent with societal norms, right? So we have common types. So we have borderline personality disorder, we have antisocial personality disorder, narcissistic personality disorder, avoidant personality disorder, dependent personality disorder, right? So into root causes, right? So we have early childhood trauma, neglect, or abuse. We have genetic and we have environmental factors we're going to take in consideration as well. And we have dysfunctional relationships or severe life stressors that take a toll on one's body, mental health, etc. Right? So I want us to take in consideration in regards to having reflective, time to really be think about something. And I want to be able to consider this, right? So do you ever feel like your reactions to situations are out of sync with others, with regards to what they expect, or, do you feel as if that you're misunderstood? These feelings may, relate to the way that your, personal traits are in regards to your personality and how you develop over time. But, I just want us to be able to take that in consideration. You know what I mean? Because people feel as if that, they gotta keep up with what's going on, right? We're not really kind of in tune on in regards to what we got going on, how we feel. Moving forward in regards to our second segment, we're going to be talking about how personality disorders affect us, right? So that BPD. So we have extreme emotions, unstable relationships. We have fear of abandonment. We have impulsive behavior, right? ASPD, we have a lack of empathy, disregarding for others' rights. We have manipulative or, deceitful behaviors. We got to also take in consideration both disorders can manifest as a result of unmet emotional needs, past traumas, or, deep-seated insecurity. We also want to include that the brain chemistry and trauma, right? So for those that, are associated with BPD or ASPD, right, we have emotional regulation issues in regards to often rise from disturbances in the brain functioning, especially in areas responses for impulse control and empathy, right? So some people out there, they may have more difficulty, but that just kind of breaks it in regards to the brain and the trauma down. But like these are some of the behaviors that are prone for, this disorder. So moving forward, I want to be able to include in regards to personality disorders don't define who you are. These patterns are, you as you change with the right tools and that support as you navigate through. So you gotta be able to take that in consideration, right? I want us to understand that we have to advocate for ourselves. No one else out there knows you more than yourself. But when you recognize these things, you recognize like these are impacting, your daily living and how you're feeling about yourself. And these are, like I said, attached to trauma. So there is people out there that are trauma informed that have more insight on that knowledge and they're able to support your needs, right? So you got to be able to take in consideration and, recognize that your experiences are something that happen, but they don't define who you are, right? So when you seek that support, have that self-compassion and, you know what I mean? Like you're really working on this personal development within yourself, things will get better. Next, we're going to be able to talk about healing and coping with personality disorders, right? So we got to take in consideration, like I said, is that the therapeutic approaches. So we have that dialectic behavior therapy, right? So it focuses on that emotional regulation, the mindfulness, so spending time with yourself, and to be able to, like kind of said, de-stress, and you'll be able to have a good like tolerance within yourself. Cognitive, behavioral therapy identifies those challenges, distorted thoughts, breaking down those thoughts help, so you're able to have proactive ones to be able to navigate and move forward, right? We also have mentalization behavioral therapy, right? So helps improve understanding of one's emotions, really going to be able to dive into your emotions, right? And other perspectives and how things are really inflicting with your body, your mind, right? What's really going on, right? And really navigating to that anxiety, whatever that feeling may be for yourself. We also have schema therapy, right, which basically focuses on identifying and altering deep-rooted negative patterns, right? So really just identifying and having someone really support and really track this with you, right? So I really want to take consideration because you're not alone, right? And I want us to take consideration that there is a professionals out there to be able to help our needs, right? So we got to be able to, like I said, advocate, recognize that what insurance do I have? Talk to somebody, right? And we'll be able to figure this thing out for yourself. So I really want you to take that in consideration, that you are not alone. Moving forward, we also want to take into consideration that there is self-regulation strategies off rip. Like I said, mindfulness is something that really wants to get away from the noise. I always tell us, put the phones down, put it on silent, get into nature, get around a bank of water, sit on the side, the bench, let the water hit, not the water, but the wind, the breeze hit your face, really let the sun gliss off your skin, right? And just really be able to just get into that and just really stay present, right? Get grounded for that moment, embrace that moment. Really just like let any like negativity flow out of your body, really embrace the positivity, and think about things that you see yourself doing in the future. Really just like a growth mindset for yourself. I really want you to be able to think about whatever is meaningful for you at that moment, right? We got to be able to have time for ourselves and really have that mindfulness, right? Moving forward, like I said too, is journaling. I want us to be able to reflect on our thoughts, our emotions, and gain that overall clarity. So this is going to be able to help us with that self-regulation. Grounding exercises too, using our sensory, techniques to be able to manage our overall, like I said, those emotions. We have the 5, 4, 3, 2, 1 method, right? Box breathing, right? There's so many different things that we can be able to do to help regulate ourselves, right? But we got to be able to be consistent. We got to be able to practice these things, right? Moving forward, I want us to be able to take consideration on building emotional intelligence, right? So, learning about ourselves. What are our needs? Right? So learning identity, right? Our expression in regards to ourselves and emotional, managing ourselves in healthy ways. We got to be able to, like ourselves, know how to read people, But we got to expect, before we're able to do that, we got to be able to know ourselves, right? And spend time with ourselves, right? With that self-compassion, right? So I really want to take that in consideration. That could really be something that can be useful for ourselves. Moving forward to our next segment, I want to be able to take in consideration is the role of support in that recovery, right? So like I said, we have those therapeutic approaches, those professionals out there, but a key concept is therapy is crucial, right? So finding a therapist who specializes in that personality disorder is vital for your progress, right? So there's someone that's catered for you, that's specialized for you, and you got to be able to find that individual, right? By, like I said, supporting that, advocating for yourself, right? Moving forward, we also have peer support groups. I work at a mental health agency right now, and I actually do support groups. So, you're able to sit in groups that other people have the same exact or, diagnosis, so you don't feel as if that you're alone in this, right? You can have your individualized therapy, don't get it twisted, but there also is groups that you're able to sit in and really have those conversations with other people that have similar challenges, and that maybe feel good because you're able to feel that comfort because you're connecting with others who understand your experiences. This can be able to help you reduce that isolation, that shame, that guilt, and those emotions, and you're able to really embrace like, okay, I ain't the only one, you feel me? And I want you to take that in consideration, those support groups, right? Moving forward, we also have building trust in relationships, right? So whether it's a partner, friend, family, healthy, supportive relationships are something that we want to be able to maintain. We got to be able to understand our emotions, and understand that healing and growth is something that we're able to do, right? So we don't want to isolate, right? We don't want to be trapped. We don't want to have those negative patterns, but we really got to be able to embrace, like I said, that support. It's out there, and we're able to continue building those relationships because we need those relationships to be able to, like I said, thrive, feel good, And like I said, the support is out there. I can't ever emphasize that enough. Moving forward on that aspect, involvement in regards to medication. That medication, while taking therapy, is known to be able to help those, have benefits in regards to, like I said, that stabilization in regards to your mood and managing that impulsivity. But check in with your doctor, like I said. When you're being consistent, when you're doing the personal development, you have the supports, you have the medication, you're doing what you have to do in your process, you're talking to your doctor, you're doing what you have to do on your aspect, and you're eating healthy, you know what I mean? Like, you're doing what you have to do, things are gonna be much better, right? But you gotta recognize that, you know, you have your diagnosis, you got to be able to have your own treatment plan, you got to be able to work on yourself, understand that the world out there, people got their own thing going on, but when it comes to your health, when it comes to your need, when it comes to your mindset, when it comes to your mental health, you got to put yourself as a priority and make sure that you're regulating yourself, you have everything got going on, right? And I believe that everything will be smooth, right? With that positive mindset. So moving forward, in regards to our next segment, we're going to be talking about hope, recovery, and regards to that growth as well. So in regards to our key concept, we're going to be talking about recovery is a process. We got to recognize that, right? So healing from, you know, a personality disorder is not just a sense of a, you know, destination, but a journey is something of growth, learning, and self-acceptance. We got to be able to take that into consideration, accepting ourselves, accepting that with, you know what I mean, that self-awareness as well. Moving forward, we got to be taking consideration is, you know, celebrate small wins, recognizing moments of that improvement. So when you're staying calm, you're recognizing your triggers, you're developing a moment of, you know, stable relationships, you know, continuing the process, you know what I mean? You talk to your therapist, like really navigating this thing, like you gotta be able to celebrate that too. So feel free to take yourself out to eat, do what you gotta do, like, you know what I mean? Celebrate yourself in a healthy way, you know what I mean? And really, you'll be able to see improvements as you're navigating forward, right? Next, we're also going to be taking into consideration is shift in identity, right? So personality disorders don't define you. I'm going to say it again. They don't define you, right? They're part of your experience, but not part of your full identity, right? So we got to take that in consideration. Our experiences don't define who we are, right? And in regards to this too, we got to take in consideration with the growth mindset. I always advocate for that positive mindset, right? So embracing the challenge, right? So learning from your mistakes and maintaining that mindset of self-compassion and that curiosity will help you navigate through. In regards to a mindset shift, you are not broken. You are on a journey of healing, and every step you take matters. Even the small progress is progress. You gotta be able to take that into consideration that, you know, the little things that do matter, it's gonna be able to help the big picture towards the long haul, the long run, whatever you wanna call it. And it's not being fast about trying to get to there. It's not about being slow. It's about doing things that are best for you, doing what you have to do for you, and putting yourself first. And that's what matters, right? So just putting this video to a close, I really want to take into consideration that you are capable of healing. We're able to do this when we're able to, like I said, have those proper supports. We're able to have that self-compassion. We're able to recognize that living with a personality disorder maybe shaped who you are in that sense, but it doesn't have a full, you know, the embrace ourselves by being authentic, fulfilling ourselves, you know, recognizing our old patterns, getting, like I said, that support, that self-compassion, and breaking free from, you know what I mean, all the other stuff, and really navigating towards what ourself and what our needs are, right? So I really advocate, like I said, put yourself first, get that support, and things will be able to improve. So if you found that this video was beneficial, give it a thumbs up, share if possible, and I'll see you on the next one. Take it easy.